Hello, my friends. This is Dr. Ruiz here at the Los Angeles Institute. And I'm excited to share this next part of the Adhesive Dentistry Magic series. Today, we're going to be talking about bonded onlays, the preparation. And of course, bonded onlays are really a replacement for a full crown. And it should be used only in cases where you have a really badly broken down tooth. So, why anomaly and why minimal invasive? Because if we needed to have a surgery, we would want minimal invasive, right? And no different in dentistry. The more damaged the tooth is, the less we would want to cut the tooth to avoid collateral damage. And unfortunately, that is not what's happening in dentistry today. We know that when a tooth is badly damaged, usually a crown is what's used, and that means aggressive tooth preparation, almost getting rid of whatever is left of the tooth, and then subgingival margins. That is not ideal. For over 20 years, minimal invasive dentistry and adhesive dentistry are here. Many years ago, I wrote an article with Dr. Gordon Christensen talking about how the myth is the belief that a crown is going to be better or last longer or be easier than a minimal invasive bonded restoration. Adhesive dentistry has been around in dentistry for a very long time, but unfortunately, it has not been used to its maximum ability. It really should be used to make things easier, faster, better for the patient and for the clinician. So, unfortunately, we still see some of the leaders in dentistry are not using adhesive dentistry correctly, not benefited from it. You see an example on the left, a class I took at the Spear Center, and you see how they're talking about adhesive dentistry, but they, you have one broken cusp, and you see at the bottom the amount of tooth that was cut away in order to use a CAD/CAM crown. The image on the right just shows wasteful buildups with no real purpose. And all of this only makes dentistry more complicated, and it loses the benefit of adhesive dentistry. So myself, my mentor and partner, Ray Bertolotti, we are all about simple dentistry that is based on scientific principles, and that's why we wrote the book Supragingival Minimally Invasive Dentistry. And everything that we share with you is based on that. So this is an example of how we believe dentistry should be done today. The idea is to cut as little as possible. You see a tooth badly broken. In the traditional approach, it would be to cut the tooth into a little peg. But realistically, the tooth is already badly broken down. The less we cut, the better. And that is really what modern dentistry should be about. And as you will see in this technique, this is a video recorded on a patient. There's a little wiggly, but you can see you're gonna see the technique, which is basically a 1.5 occlusal reduction to create space for an onlay made out of Emax, lithium disilicate. So the only thing that I'm trying to do is I'm trying to create space for that material there, and create, of course, a form that is more ideal. So I'm doing the 1.5 millimeter reduction. Usually I use depth cuts to do that. I brought the handpiece in a reverse form because the patient's tongue was very wiggly, and I was trying to protect it. This is more the way I do this, a facial reduction of the one cusp that still exists, and the occlusal reduction, and that was a 1.5 reduction, again, using depth cuts. So we're done pretty much with the occlusal reduction. What I'm starting to do now is starting to make sure that the whatever the old filling didn't look very good. I was trying to remove it. Now I'm doing what we call a U-shaped reduction for the proximal preparation. So I'm not a fan of using boxes. Boxes are very destructive and often bring us subgingival. So I like a U-shaped reduction. Basically, you see the angle of the burr. This is an occlusal reduction burr, which is part of our occlusal reduction kit. This is sold by Brasseler. If you look for the Dr. Ruiz Los Angeles Institute burr kit, and then now I'm cleaning up, removing whatever loose enamel, and also do the caries removal. There was clearly some caries, so I drilled it off. Today, the standard of care is to be minimally invasive on caries removal. I'm a big fan of Dr. Rella Christensen, who's done a lot of research on this, and we understand that the idea is to remove the highly demineralized dentin, and that gets marked clearly when we use caries detectors. And I apply the caries detector for between 5 and 10 seconds, then wash. And anything that is bright red has to be removed. It's very simple to identify. I tend to do it 2 or 3 times until I'm comfortable that there's nothing that is staining bright red. If anything's staining bright red, then I go back and remove it. Once I feel that it's clean, that there's nothing staining anymore, then the last step of my preparation, this preparation is almost finished. I'm basically now making sure that all the periphery is nice and continuous and smooth. So I'm a lab technician, so I'm also, I also think a lot about what the lab technician would want to be able to create the restoration. And they want a smooth, continuous cable margins. What I'm doing there is I'm doing a little more interproximal separation. I'm using a mosquito burr and just creating an ever so slight separation, again for the same purpose, to give the lab technician a clear margin that they need. I'm checking for clearance. And guess what? We're done. Now, do you see how little tooth I had to cut? That makes me very, very happy, because then the collateral damage is not there. The other thing that makes me very happy is how little there was no bleeding, right? What a wonderful thing. This is what we call supragingival, minimally invasive type of preparation. So I have to say, we've been doing this for way over 25 years and teaching it at the Los Angeles Institute, and a few thousand people have gone through our courses. And of course, I would like to make that invitation to you if you're interested in learning more about how to do this onlays instead of crowns, and realizing that it's easier, faster, better, more predictable, more durable. Wow. Why is it that we're not doing it more? Well, my friends, it's been an absolute pleasure. I'm honored that you spent a few minutes with me, and I look forward to the next installment, which is going to be about bonding that onlay. And wish you all the best. Have a nice day.